Hey, Healthcare Experience Matters listeners. It's your podcast host and producer, Casey Callahan, back with you today, joined by Geeta Nayyar. We call her Dr. G. She is a doctor and a globally recognized chief medical officer, technologist, best-selling author. She's also a rheumatologist by training. Dr. G earned her medical degree at the University of Miami's Miller School of Medicine, where she currently still resides. And I want to ask her some questions today because, as you know, she is a leading expert, best-selling author, and I want to know what we can learn from her when it comes to like what's going on with misinformation in healthcare and some strategies for clinicians or those working in healthcare to kind of be on the a lookout for. So, Dr. G, welcome to the show. I'll just have you kick this off for us by kind of just introducing yourself and telling us maybe something I missed out there in your intro.
Sure. Well, first of all, Casey, thank you so much for having me, for covering the topic. And I'm just thrilled this is something you have on your radar for your audience.
Absolutely. And so, like, first of all, can you just define misinformation for us? And I guess we can kind of just start there. I know it is a difficult task, but let's just try to start there.
Sure, you bet. So misinformation is essentially just getting the facts wrong, right? For whatever reason, it's sort of an innocent misunderstanding of the facts. Disinformation is actually when you intentionally manipulate the facts and try to manipulate the masses for some ulterior gain. So what might that be? It might be financial, it might be political, it might be to spread sort of your subscription base or to increase your following by being provocative. So as you know, we're living in an era of mis and disinformation. And I think the biggest thing for your audience to understand is that they know it's not new. All the people that are working in healthcare know it's not new. But the difference now in living in a tech-forward consumer society as well as a tech-forward medical industry is that it's getting worse. Because the reality is that because of the era of technology we're living in, mis and disinformation is actually spreading 6 times faster than the facts. And if we think about where artificial intelligence could take this, it could essentially exponentially either enhance our good habits or our bad habits. And so that's really where we have to be mindful and understand that while healthcare has accepted that we work and live and practice in an environment completely full of mis and disinformation, it is only getting worse and it's only going to impact the practice of medicine more. And really the call to action in the book is to say this is healthcare's problem to solve. For too long, we've kind of accepted it as the invisible enemy, but it's becoming increasingly part of the narrative and increasingly easier for our patients to drink the bad Kool-Aid and then come to us for solutions after the fact.
Yeah. And if you don't mind, just mention the name of the book there for our listeners. And I'm going to ask you a little bit more about that too.
Sure. So the book is called Dead Wrong, right here behind me. I'm very proud. It's now a Wall Street Journal and USA Today bestseller, and continues to really just, be on the forefront of conversations with policymakers, at keynotes, at big industry events. This topic is one that I think everyone's really leaning into, given the environment that we're currently in, a post-pandemic sort of era of tech.
Definitely. And what are some of the solutions that you propose in the book that we should at least be aware of? And then we can start there.
Sure. Well, specifically for your audience, right? Because I certainly have tips for consumers, but I think for your audience, chapter 8 really goes through this really beautifully and actually talks about the Cleveland Clinic in particular and how they sort of headed off this issue and used it to really figure out how to scale trust. And the first thing is to realize that when thinking about mis and disinformation, if we look at the healthcare executives across the world, no one is actually in charge of the mis and disinformation strategy. Right. No one ever raises their hand when I'm, doing a keynote and I say, who's in charge of this? No one ever raises their hand. But everyone at every organization in healthcare seems to own a piece of consumer experience, value-based care, consumer engagement, patient acquisition, brand loyalty, patient retention, right? You name it. So my point is exactly that this does touch the work that every healthcare organization is doing. But the fact that we miss this altogether speaks volumes. And so my advice to those on the call would be, look, if you touch any of those things, if any of those things are your initiatives or strategies you touch, you need to be asking yourself this question. The second piece is really understanding that the healthcare remains a team sport. And right, this issue in particular needs to be that trifecta between the chief medical officer, the chief marketing officer, and the chief information officer. Why do I say that? Well, the chief medical officer knows that their staff is dealing with this. It's actually a big contributor to physician burnout when patients walk in and basically, hey, doc, you don't know what you're talking about. I got all my information from TikTok, so I'm good, right? It's a big dissatisfier for docs, so it's important for that reason. Two, important for clinical reasons, because, for example, when you're in a value-based care environment, no one's getting a mammogram if they don't know what a mammogram is, right? And so how do you get the message out about preventative measures in particular in a really reachable and inspiring way? And that really requires a partnership between marketing and clinical, and also tech, because all of the technology apertures, right? When we think of hospital systems, we think of providers, payers, there's numerous ways now. There's omni-channel approaches to how to actually engage the patient, but in ways that drive behavior and next best action, whether an appointment, whether a virtual visit, et cetera. And I think the last point is simply that we think of marketing globally in healthcare. We often think of marketing as a bit taboo, a bit unnecessary. Patients are going to come. We don't really need to do marketing. But in today's era, where 59 million Americans turn to social media influencers for information about their healthcare, marketing is in fact patient education. And we need to treat it as such. And really, the best accountability we have as healthcare leaders is that we can not only get the facts out there, but we also are accountable, right? Cleveland Clinic, I talk about this in chapter 8. I mean, you look at the content Cleveland Clinic has there, they have a video on everything, and they invite you to make an appointment, right? To read this information and then make an appointment. And if something doesn't go right, they're accountable. And that's really the biggest difference when we think about some of the TikTok influencers out there, is they are spewing forth and selling all kinds of lifestyle supplements, et cetera, but they're not really accountable. And so understanding that as a healthcare entity, that that's our superpower, is that we're in the business of healthcare information. We're in the business of healthcare caretaking. And we really need to own that patient journey, soup to nuts, and it will drive outcomes, and it will drive all the things that we're trying to do, whether in fee for service or value-based care.
Yeah, this is a really important discussion, especially as these short form video platforms, like you mentioned, TikTok, they continue to explode in popularity. They have very catchy production values and all that type of thing. And yeah, I think I couldn't agree more with a lot of what you're saying. The consequences are there if inaction continues to take place in a lot of ways. Is there anything else that you wanted to make mention of when it comes to this effort of scaling trust, as you put it, before we wrap it up here today?
Well, I think another thing to keep in mind is traditionally, particularly on the provider side, we're always concerned about competing with the hospital down the street or the doctor down the street. Social media has effectively changed that. The new entrants in healthcare, the different virtual services have really changed that. And so the big importance in branding and brand awareness and brand loyalty is part of this, right? Because now patients are going to anyone offering them healthcare advice or healthcare services. And that's not necessarily a doctor or anyone, any sort of licensed professional. There's now a sort of different competition of influence and loyalty being built. So the smarter we can be about owning that information, owning that narrative, and also owning the value prop of, we're here to take care of you. And actually our incentives align to taking care of you, whereas it's not necessarily the case for many competitors. And look, this is not about doing the right thing. This is actually about revenue, and they happen to actually match. And I love, right? I love when you can actually do good work and also make good money. And so when you look at this from a revenue standpoint, it's really common sense, because this really drives the business of healthcare. And if you can do it well, like the Cleveland Clinic, your patients will have no reason to go anywhere else. But when you leave that gap open and you say, this is not my issue, or it's not worth investing the dollars, you leave that gap open for competition and for lost revenues. And it's very difficult to get those back. So I would just like to drive home the point that that's really what scaling trust and the message is about, is essentially about patient acquisition and retention.
Yeah, that's really well said. And, a shout out to all the organizations that are taking the time, that are making the investments to create this peer-reviewed patient education. I was fortunate enough to be a part of some of that process when I worked at the American Urological Association and the Urology Health website that we had, urologyhealth.org. And yeah, I know a little bit about that process, and it is a major investment of time and resources. But as we're talking about today, the investment is certainly worth it. So we've been listening to Dr. G. Her name is Geeta Nayyar. She's a rheumatologist by training, and of course, now a globally recognized chief medical officer, technologist, and congratulations on being a best-selling author as well. The book is Dead Wrong. We will include a link to that in the description of today's podcast. Thank you so much for your time today, Dr. G.
Thanks for having me, Casey.